Rosario Bacani, 77 years old, from Quezon City. I'm here to do non-surgical procedure for my face, and my concern is my drooping eyes and my drooping face.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll answer a question whereby one of my clients before were asking, is it still safe to do tread lifting for those individuals who are 70 and above? Well, let's answer that today. So, before that, let's welcome our new guest today, Ma'am Rosario. Hello, Ma'am Rose.
Hi, good morning.
Good morning. So, Ma'am Rosario, she's how young?
I'm 77 years old.
Oh, yun. Okay po. A while ago, I was interviewing Ma'am Rosario if she had any treatments before, like mga non-surgical procedures. And she shared with me about Botox treatment. And her experience was that you said parang gulat, parang something uneven or something na weird experience. Right, Ma'am Rose?
Right.
Yeah. Because with Botox treatment, of course, we wanted to treat some lines and wrinkles. But of course, we wanted you to still have that good expression. Hindi yung parang paralyzed, sobra, or parang frozen face na no more facial expression. Especially with the age of Ma'am Rosario, we wanted that they only have this relaxed and refreshed look na natural pa rin. Right, ma'am? And you were saying something realistic, like I'm 70, of course, I still look like in that age, but they were saying like, oh, Rose, you look so refreshed. Like, Rose, you're blooming today. Something like that, right?
Right.
So we have treatments that are like alternatives to Botox because we have like patients who don't want to go or rather receive Botox treatments anymore because of some experiences that they said, oh, lalong nagbagsak yung mata ko o kaya I can't open my eyes anymore. Because Botox is like targeting facial muscles. And when you like treat facial muscles, Botox will make the muscle not move anymore. So if you're like injecting around the eye area, you might experience na, oh, I cannot open my eyes anymore. Because the muscles around the eye area were like inhibited by the Botox. Hindi na gumagalaw.
Right.
So, you cannot, like, the muscle that will open your eye, like your frontalis muscle, it was like treated with Botox, you can't open it anymore. So, like for Ma'am Rosario, actually, I won't really recommend Botox anymore. I wanted a treatment that will still give that relaxation and at the same time, rejuvenate the face. Right? Excited po ako.
Yeah.
I'm so excited.
I'm also excited.
Opo. And of course, we want a treatment that is very safe.
Yes.
Importante yung
That's
safety
true.
there. Exactly.
Pinaka-importante.
Opo. So, Ma'am Rose, what kind of treatment, what procedure will show that when CSA Medical Aesthetics return? And we're back. So what kind of treatment are we going to do for Ma'am Rosario? But before that, let's do a so-called assessment. Okay, the upper third of Ma'am Rosario, as we noticed a while ago, like, well, the main concern was the hoodedness of the upper eyelid here, okay? And of course, well, fine lines, wrinkles, then some hollowness there, even in the temple region. So these ones are for the upper third. Well, those are the ones we primarily correct. And when you go to the middle part of the face, okay, so the mid-face section, you notice some mid-cheek groove there, and also the nasolabial fold there, and then the ptosis, the so-called ptosis here. The others will also have the so-called like some lines here too, and then some subzygoma depression here. Then when you go on the lower third of the face, the so-called sagginess too, some jowls there, marionette lines there, and loss of jawline definition here. And also on the chin part, some people will have this like dimpling there, or like a orange, something like a type of skin here. And then when you go down here, some sagginess there, or like the turkey neck that they call it, and then the necklines. For Ma'am Rose, since it's my first time to handle hair, I want to be very conservative at first, okay? So the treatment that I'll be applying for her right now will be the so-called PDO thread lifting. So I wanted to use those kinds of protein threads to help stimulate collagen and also elastin and other kinds of tissue matrix substances, okay? So I wanted to still tap those kinds of like molecular structures inside the tissues of Ma'am Rose, okay? Okay ba yun, Ma'am Rose?
Alright.
Yeah. So we'll be doing some partial treatments for today. So we'll have a so-called series of treatments, Ma'am Rose. So hindi naman po natin bibiglain. We will be like doing like stages of treatment. So for the upper third, so our concern here is this ptosis of the upper part here. So we want to kind of lift this part here. And the PDO thread lifting will be a good one, whereby when we insert it here, we can somehow reach some of the saggy tissues here and pull it up like that, okay? So for the upper third, that's gonna be the one that I'm gonna be doing. Then the middle third, I'll be also be doing the so-called PDO thread lifting here, pull from this saggy mid-face here and bring it back to this part of the zygoma area. And then also same thing on the jowl part, and do it like this. Okay, so we can see some results already right now. Okay, so anatomically speaking, of course, on the upper third, you have to like make a marking of your supraorbital, supratrochlear structures there. Mid-face, of course, your infraorbital foramen structure there, some blood vessels and nerves there. And then also on the sides of the face, some zygomaticofacial vessels here. And then, of course, take note of the facial nerve branches here. Then when you go to the lower third, of course, your facial artery coming out and going up like that, and the branches of it. So anatomically speaking, those are the structures you need to know. And then your land markings, okay, you do divisions of, again, upper third, middle third, lower third, and you follow those, like, which is the anterior border, posterior, and inferior borders, okay? So as for any kinds of treatment, you cleanse the face, anesthetize with your numbing cream. And then with PDO thread lifting, we can do a local anesthesia, especially on our entry point. So I'll start with the upper third of the face, okay? So I'll be doing a lifting of the brow area here. So my entry point will be at this middle portion of this, like the part of our right frontalis area here, okay? Now I'm looking at this section, I notice a sentinel vein. Okay, for doctors, they know this. So if you have a vessel like that, you really have to avoid it. So she has a visible sentinel vein here. And so if that is the case, then we can do like an entry point that's either gonna be to the other side, like for example, this part here. So I'll just make an entry point here. Ma'am Rose, I'm just gonna inject a lidocaine to numb the skin. Okay lang po. Inhale and exhale. Tiny prick lang po, and then yun na po, yung pampamanhid. There you go. So that's my entry point. Now, same thing on the left side here. Okay. So there's a sentinel vein here, so I'll be avoiding that. This is gonna be my entry point here. Okay. And then, you can make your injections of your anesthesia in the tract of your threads there, okay? While you're injecting it, you can ask your assistant can spray some of our anesthesia spray also there, and at the same time be like applying anything that's cold or like an ice gel there. So my technique will be the so-called like a fanning technique of my thread here, but I'll be starting with 2 pieces of my thread. So the kind of thread that I'll be using is the so-called hug thread, and the length will be the so-called 60mm length, and it will have a gauge 21. Okay. So starting with the entry point, we'll make a puncture of the entry point here. So you'll use a gauge 18, a tiny puncture point, and then like I have a cog thread here, it's 60mm, and then you just glide it towards this side here. So if you make your land markings, you can make your drawing, then just follow that. Okay. Comfortably lang si Ma'am Rose. So reach this part here, the soft tissue here. There's an orbital retaining ligament there. You want to reach that, and later on we'll be pulling the tissues there. So just 2 pieces of this for the meantime. Okay, and then pull out. And then you can already do your lifting there. So there's a noticeable like pull of the thread of these tissues here. So starting with just 2 pieces. Next time we'll add more, Ma'am Rose, okay? Okay. So as I've said, we'll do like a partial treatment for now. Okay po? Kasi sa age ni Ma'am, we wanted muna like little by little. Okay. Baka po hindi na 70s. So we'll just make it like a gradual or step-by-step procedure. So she has a very high tolerance. So actually, whenever we inject the lidocaine, there's really a discomfort with the lidocaine solution. The others, some patients of mine are saying it's like having like a burning sensation. That's what they were saying. Yeah, I think, yeah, because I did mine too. Like I had a lidocaine injection on my face, and then it's like, wow, it's burning. It really stinks. Pero si Ma'am, very high tolerance. Right, Ma'am Rose? Malakas ang yes po. And then, so your entry point here again, and then glide your cannula here towards that, like this is the tail of the eyebrow here, and you can pull it. The other method that we can also apply is the so-called reverse method, whereby your entry point is here at the upper eyelid region or the tail of the eyebrow, and that part there, that line there, you can use that as your entry point too. So we're done with the second cog thread here. Okay, and we'll pull it and cut. Okay, so after the upper third or the forehead region, forehead lifting, we'll proceed to the mid-face section. Okay, ayan, no? I noticed lifting. So basically, we have lifted more of the lateral brow section. Okay, so in the next treatment of Ma'am, we'll be doing the center part here and more of lifting of the medial, rather the center or the between the eyebrows. Okay po. So kayang-kaya, Ma'am Rose. Okay. So we will proceed to the mid-face area. So we wanted to do a lifting of this part of the mid-cheek section here. For the mid-face and the lower face, I'll be using a different kind of a PDO thread, the so-called N-flip. So before that, we'll inject a lidocaine on our entry point here. So I'll make 4 entry points, 2 on this mid-face section and 2 on the lower face section, okay? So Ma'am Rosario has a high tolerance to pain, so she's good. And you can also do a so-called nerve block. You can inject on the infraorbital foramen here, like just a few of your medicine here. So direct it here, and then push a little bit of your lidocaine there. Just a minimal amount, okay? And then after that, we also have the mentalis nerve block over here. So direct your needle there, and then a little bit there. It's just like doing a dental nerve block. So she won't be feeling the insertions of those bulbs. And also, along the path of your thread, you can do a local anesthesia injection too. So just a little bit there, because it's not good to also over anesthetize, okay, after the procedure. to prevent a lot of swelling there and some immobility with the facial tissues. Okay, so for the mid-face, okay, I'll be trying another kind of thread, the so-called N-flip. And I have here a gauge 23, 60mm length N-flip from N-finders. Okay, so insert, initially make it perpendicular like that, and then glide towards the target tissue. So if your target tissue is the malar section, just glide it towards there, and there you go. So insert your entire cannula length, and then pull it out, and then once you see the end, the other strand there, and then make a flip like that. Okay, just a little bit, and then rotate, and in the same entry point, so make it perpendicular there again. So for doctors with sharp vision, it's easy to see. So you can reinsert this strand. So no need for you to be cutting any excess thread there, and just reinsert it like that. Okay, so now we can pull it out. So that's the N-flip. Okay, so we'll proceed to the second entry point for the mid-face section. So I'll still add lidocaine so that Ma'am Rose will be comfortable later on. So I'm using a new kind of PDO technique lifting here, and it's the so-called N-flip. So you don't need to cut anymore the remaining strand when you remove your cannula. So again, this is gauge 23, and it has a length of 60mm. So perpendicularly at first, and then glide. So the anatomical layer is significant also. Okay, when you're doing your threads, we were taught that we need to place it in that fatty layer and smash layer. Okay, so glide it there. So entire length of the cannula is already inside, and then we pull it out. And once you pull it out, so you have this remaining strand. Now the PDO, we don't want to waste it. Okay, if you don't want to waste it, and then just reinsert it inside again, and then glide it there again. So there you go. So we don't need to cut anymore. Okay, so our next, okay, so again you can numb the area here, and then the track of the thread here. So just a little bit there, and then entry point, and then our N-flip thread. So this is a different kind of PDO. Before, we've been using like N-fix and spiral. Right now, we have the so-called N-flip. Okay, so glide again towards the lower part of the face. Okay, there you go. So we're reaching this superior jowl here, and then we pull it out, and then you can rotate it like that or flip it and reinsert it inside again. So, and go to a deeper plane there. Okay, and then next, the last one. So make your entry point anesthetized, then just glide. Okay, we're gonna make our puncture here, and this is our final N-flip here, N-flip rather. N-flip. Okay. And then glide towards the jowl section, and then pull it out and rotate it and reinsert it again. Just have a little more space there. And then reinsert it again and insert it in another plane, a deeper plane. Okay, there you go. So done on the right side of the face. So we're proceeding to the left side, so mid-face section and then the lower third of the face. So numbing the area for your entry point. Okay, so I'll make 4 entry points here. I already inject the entry points, and then do your nerve block here. Tuloy-tuloy na pala din tayo, and then here. Okay, there you go. And then further anesthetize the track of the thread. So we're treating the sagginess and the ptosis And we're restoring that lifted look, entry point. So the first N-flip, N-flip, N-flip. And then insert, and glide. And then pull out. And then flip. So it's same location and then insert. Insert. Okay, and then out. Next, second N-flip, glide, and then pull, and then flip, insert, push, and then third N-flip, perpendicular, glide, some resistance, and then pull out, and then flip, insert, glide, and then last N-flip, fourth N-flip, and flip, and flip, and flip. Just like that later. So we are on the final N-flip. So glide again into that anatomical layer. There's mask layer, and then rotate, and we insert same entry point, and then in a deeper plane, and we're gonna pull out. Okay, so we've done the so-called N-flip treatment for Ma'am Rosario. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll now show the result to Ma'am Rosario. Ma'am, here's our mirror. You can check na po. Yan po.
Wow!
Yeah.
Younger by how many years? Thank you, Doctora.
So what we did for Ma'am Rose, kasi it's like we started with a partial treatment for now, okay? A while ago, when we did the assessment, we were like discussing about what are the concerns on the upper third, the middle third, the lower third. And what I just did right now, it's just like a preliminary procedure for Ma'am Rose. So actually, I was still assessing her. I was like mentioning to Ma'am Rose, next time we'll still do further lifting of this corner of the eye. Okay, this part here. Okay, like the technique for the fox eye thread lift. Okay, just to really, we want to open her eyes, and also in the center region here. We'll also be doing a lifting here to really help this saggy part here. For others, they are already being told or advised to do a so-called like blepharoplasty. But I think Ma'am Rose is still like, you're okay with non-surgical procedures, right? You just wanted to do some enhancements. Yes.
Right.
And we can still like help the skin tissues here like tighten and become firmer. So we can just like lift it a little bit like that. So we still have like series of treatments for Ma'am Rosario, especially around the eye area. And in the mid-face section, like the tear trough here and palpebromalar groove, and also this mid-cheek groove here, we can still like do procedure like, for example, our end scaffold here to pull it like that. Okay, so basically today we just did like 2 spiral cog 60mm here, 2 spiral cog 60mm there, and also like the N-flip threads here. So like per side you can use, like I did right now, actually use like up to 8 N-flips on each side. Okay, so for the others, they can start with like 2 per side or something like that. It will depend on your assessment also and on the need of our clients. Okay, thank you so much, Ma'am Rose.
Thank you, Doctor.
So we'll still do follow-up for you. We can still check on like how will it improve the laxity, the sagginess. Okay, so it's gonna be a gradual treatment. Yan.
Okay.
So I think for those televiewers who were wondering like at their age 70 above, can they still do treatments like this cog thread lift, PDO thread lifting? Is it safe? And is it painful? That's an important question.
Actually, it's not really painful.
Oh, okay. So, Ma'am Rosario is sharing with us na for her experience, it's not painful. Yeah, it's for me. It's I could say it's tolerable because we did like injections of anesthesia to really numb. Actually, the insertion of the threads, because it's numb because of what we did, nerve blocks.
I didn't feel anything.
Yeah. But for the others, they were telling me like when we inject the lidocaine, there's a burning or stinging sensation. Yun lang po. But you felt also po, no, yung insertion ng anesthesia.
Oh, yeah, yung anesthesia.
Anesthesia,
Yes.
yes po. But after
But
that,
the
it's painless na. Okay, thank you, Ma'am Rose.
Thank you so much.
And thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Our other videos are at our YouTube channel, Contessa Salvador Alapag. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.